We're really excited to bring fellows here to UTHealth Houston in the Department of Orthopedics to start a brand new fellowship.
You know, your fellows are basically the life force of the program. Ultimately, our success is in the success of our trainees, and we want them to not only have a broad experience here, we want them to be comfortable and be able to give back.
So I've been here at UT since I finished my fellowship. I truly enjoy working with the residents and look forward to incorporating the fellows in our pediatric spine deformity practice. I think it's going to be very welcome to bring in the fellows and get to expose them to our vast pediatric deformity practice that we have here.
I think being part of a new fellowship program is something that's very valuable and an exciting opportunity. I think being able to work with Dr. Kleinberg and Dr. Marco, who recently joined the program, is something that's very valuable.
The mentors in this program are approachable, kind, and respectful, and that encourages mentorship and guidance. And we look at you as colleagues, which also helps foster that collegiality.
I think that you will be a sport for choice as far as how to tailor the fellowship to what you want to do and what kind of surgeon you want to become.
I think that spine surgery is growing and it's becoming more and more complex. And if I had to give one advice is focus. Find what makes you tick, find what interests you, and focus in that. We treat tumors and trauma and degenerative conditions and deformity, and that gives the trainee the opportunity to taste each and every one of those fields and find what makes them interested.
I think this is one of the unique things about the fellowship here is the exposure to pediatric deformity that certainly is unique among spine fellowships, and just providing that breadth and depth of complexity.
Bringing you on as junior faculty allows us to help you develop into independent practitioners by giving you the freedom to see patients in the emergency room, on the floor, and in the clinic, evaluate them and make your own decisions. And then, if needed, you can indicate them for surgery and make your own decisions in the operating room under our guidance.
We are very much looking to create like a league of newer generations of surgeons who are very well trained and that have a relationship with us that doesn't only exist for that 1 year.
You don't really anticipate the things or the challenges that you have on early in practice, and so being able to work with them and then try to help anticipate those kind of hardships hopefully will make it easier for them in the future.
My expectation is that we learn together. I tell you and show you how I like to position the patients, how we prep the patients, how we start thinking about the surgery, and then how we perform the surgery. The Houston area is huge and it is growing, and here at the TMC, UT plays a pivotal role as one of the largest players in one of the largest medical complexes in the world.
Houston as a city is great. A million things to do with cultural festivals, music festivals, art festivals. Different areas of town bring different appeals and different vibes.
Great place to raise a family, lots of very good schools, all within close proximity to the medical center, specifically for trainees with families to live.
A lot of the residents that have trained here have come back and joined us, and it just tells you that this program is a great place to not only train during residency and for fellowship, but places that some people want to come back and work. As the busiest trauma center in the world, we have roughly somewhere around 14,000 level 1 trauma patients per year. So the volume of patients that we see is high, and they're complex patients.
I'm very excited to be here. I'm looking forward to see the growth. Already in the short time that I've been here, it feels like things have changed dramatically for the better. It's an exciting time to be here at UT Health.